another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Larry Rosen, who's an integrative pediatrician. Lawrence Rosen, MD, is an integrative pediatrician and co-author of Treatment Alternatives for Children, an evidence-based guide for parents interested in natural solutions for common childhood ailments. He is the founder of one of the country's first screen pediatric practices, the Whole Child Center, located in Oradell, New Jersey. And he serves as medical advisor to the Environmental Health Center at HackensackUMC Medical Center. Dr. Rosen is a founding member and past chair of the American Academy of Pediatrics section on Integrative Medicine and is appointed as clinical assistant professor in pediatrics at New Jersey Medical School. A graduate of New York Medical College and the Massachusetts Institute of Technology, he completed his residency and chief residency in pediatrics at Mount Sinai Hospital in New York. Dr. Rosen has been featured on Good Morning America, CNN, and Imus in the Morning, and is a frequently cited expert on children's and environmental health matters. He's a contributing editor and pediatric columnist for Kiwi Magazine, as well as a contributing author and editor for several books. Dr. Rosen serves on many integrative health advisory boards and contributes regularly to the Huffington Post and Mind Body Green. For more information, check out his website, wholechildorg. Welcome, Dr. Rosen.
Thank you very much. Thanks for having me.
I'm so excited to have you on our show today to really share more with our listeners about your perspective on how to keep children healthy and happy.
Yeah, no, it's great. I love when we have an opportunity for different kinds of practitioners to talk, or we're all in it for the same reason.
Yep, that's right. And you and I have known each other for years, and we've shared a lot of patients over the years, and it's just always been such a pleasure for me to have to refer patients to you and to have them receive your care, because your philosophy on health matches mine on really supporting the whole child, which is the mind, body, spirit, component. So it's really cool to have you as a colleague.
Oh, well, thank you, and I appreciate you saying that. I feel the same way, and I think it's so important, just kind of on a meta level, to think about, we're all doing this together. And I think I read an interesting statistic a number of years ago. There was a study that looked at the number of visits that kids have to chiropractors is more than the number of visits to pediatricians. And so we know, at least in certain parts of the country, that parents and families are accessing health care in a lot of different ways, and I 100% support that. I think that's terrific, and I've always made it a point of trying to work together with other people in the community and share families and share cases, and I think ultimately that's what keeps kids optimally healthy.
I completely agree, and I haven't actually seen that study, but I have a feeling that's probably on the West Coast.
Yeah,
like
it's interesting. I'm sure it is, but I think it was from Boston, interestingly.
That is interesting.
Which is kind of like a hotbed of academic medicine. So, it's interesting. I'll find you the study, but it doesn't surprise me. I think that most pediatricians would be surprised to hear that because they don't ask the question or they're not sort of open to it. But I think that that's probably true.
So cool. Thank you for sharing that.
Yeah, sure.
And I'd love for you to start off with just really telling our audience about your personal story of why you chose to become an integrative pediatrician and build one of the first green pediatric practices.
Sure. It's interesting for me. I was not one of those people who, knew from the moment I was born I was going to be a doctor and went into medicine. I grew up in northern New Jersey and was in a family that there are no doctors and really no healthcare practitioners. So for me, my first experiences were just going to the pediatrician, and thankfully I was a pretty well kid growing up, and my parents didn't have sort of any unique holistic perspective on medicine other than just, you went when you needed to. It wasn't something we did all the time. I always kind of valued the preventive aspect of staying well rather than just treating things as they happen. And as I got older and into college years, I became more and more interested in the mind-body aspects of health and healing, and interested in neuroscience and how the brain works. And that really was my first interest in health. And I studied brain science at MIT, and for a very academic, science-y kind of place, I had a lot of good fortune at connecting with people who were starting to look at things like nutrition and meditation and other areas that affected how we are and how we think. And so that was my initial interest in medicine to begin with. So you can imagine when I got to medical school and, the whole art of medicine thing and the human aspect was what I was interested in. That was not the priority of most of the people who were teaching me. So I had to kind of just make my way through medical school and keep that in the back of my mind and through my conventional training. And it really wasn't until several years into practice, that this would have been, late 90s, let's say, when two things happened. I had started in a primary care practice in New Jersey, and my first child was born, and he's now 17. And so those two things taught me how little I actually knew about health from a really preventive basis aspect. I was really good at emergency care and intensive unit care and treating really complex problems as they develop, but I was not very knowledgeable about food and parenting and development and how to keep people healthy. So that was disturbing to me. And I have to say, really, my interest in integrative medicine came from families who kept coming to me and saying, my child has this going on or that going on. I went to a chiropractor, or I went to a nutritionist, I went to an acupuncturist. We started doing yoga, and they would tell me these stories that were fascinating because the kids were getting better, but it had nothing to do with the stuff I was prescribing. In fact, as I prescribed fewer and fewer things, I found the kids were healthier. Right. So for whatever reason, it sort of reminded me of why I went into medicine in the first place, and I had these great relationships with families that I was developing, and so I started to look into these different areas and retraining myself in areas, really basic things like, how to feed babies and learning about nutrition and how nutrition can heal different conditions, the whole idea of inflammation and anti-inflammatory approaches. And then I started to bring in a few areas of integrative health that I was comfortable practicing, like guided imagery or self-hypnosis, biofeedback, and really focusing on the mind-body aspects. And it really invigorated my whole practice and reminded me of why I wanted to be a doctor in the first place. And the other great thing that happened at this time was I started to connect to other practitioners in the community, like yourself and other people who were practicing, and learning from them about their styles of practice, how they were helping kids. And then I started to have a referral base and a base of colleagues that I could talk to and talk about cases with. And I started to bring that on a national level as well, working with the American Academy of Pediatrics and other groups to develop and look at integrative models that we could build in our communities. But a big piece of that for me always has been not seeing pediatricians as the one and only way to deliver health care, that we really need an integrative system. So that all that work sort of in the mid-2000s led to me realizing I had to leave and start my own practice so that the entire practice could be integrative, and that in our space all of the practitioners would believe in an integrative model, and that we could bring in things like yoga and acupuncture and infant massage and a number of other areas, not necessarily to replace what was going on in the community, but to continue to partner with practitioners, but do here what we could with the families that we have. And another big piece of that, you mentioned the green practice part of it, was to build a place that respected the fact that how we practice healthcare has an impact on the environment. And I was keenly aware of environmental health issues that were developing and how the environment was causing difficulties for our kids' health, but also wanted to practice in a way that honored that. So when we built our space, we used materials, and we continue to use, cleaning products and have policies and procedures that are ecologically sustainable. And I think that's a really important model for healthcare going forward. And that was in 2008, and here we are years later, and we're doing really well. Yeah,
your practice is so super successful, and it's fun for me to watch the evolution of like, oh, he's only accepting newborns now.
Oh,
this
yeah.
You are.
Yeah, it's the blessing and the curse. We knew that it just felt right, and it came from my heart, and I knew that the model that we were practicing spoke to families, but there's a limit. You can only see part of the integrative model, and doctors seem to be the last ones to get this, is you can't see 50 people a day and spend time with people and really develop those relationships that are so important for healing.
Right.
So one of the things we had to do is figure out how can we honor the kind of practice we want to have where we don't see 50 kids a day, where we see 10 to 20 kids a day per practitioner, and I can spend 45 minutes or an hour with someone when I need to. I can't do that in a typical pediatric practice. Right. So that was a challenge, and for a couple of years we had to shut down to new patients. But now I think that we've figured out a way, I think, that works for as many people as we can, and it's not perfect, but I think we still are honoring the way that we need to practice.
Right, and then to your point, you've been able to bring on more practitioners so that, your practice can, see more patients, but they're still getting the individualized, care that they need and the time that they need for that relationship.
Yeah, absolutely. Yeah. That's been important. Yep.
And, I also, really just want to, honor the fact that you put a lot of thought into building that green practice, and even just the choice of what type of cleaning products you use is such an important model, I think, for families, what they're doing in their homes as far as construction materials as well as cleaning products. It's just important for people to have that awareness of toxic exposure, especially for children. A couple episodes ago, I interviewed a woman who created a documentary called Toxic Baby. Mm-hmm. Know if you're familiar with it. And it's just bringing in awareness to families of how many chemicals we're exposed to on a regular basis and what we can do to minimize our exposure. And we're not going to eliminate it, unfortunately, but we can certainly reduce the exposure for our families. And, cleaning products is one of the first ways to start.
Yeah, no, it's so true. Even just today I saw there was an article or a news piece about something about women put an average of 160-something chemicals on their bodies every day. And I think it was the Environmental Working Group or one of these groups. And so we do a lot of counseling around, how to limit your exposure to toxins in your environment. And it would have felt fake to be practicing in this place, especially when I had a choice where you're breathing in fumes from, off-gassing from cabinetry or for exam tables, or, when you walk into a healthcare space and you get that smell of cleaners, it's like ammonia and bleach and all this other stuff, and it smells sickly to me. So I had the great fortune of working with Deirdre Imus and her group at Hackensack University Medical Center when they were building an entire hospital, the Children and Women's Hospital there, using green principles. And so I was able to observe on that scale how they did it, and I thought, okay, I can definitely adapt that to my, 4,000 square foot space. It's not a 200,000 square foot hospital. I don't have an operating room. There's certain things I don't have to worry about, but we were able to do as much as we can. And I think you're right. That serves as a role model. We can serve as a role model for our patients and teach them, you can do this.
Yeah, it's doable. It's not hard. It's just really, being an educated consumer. A lot of my guests on my podcast are talking about the Environmental Working Group. It's a topic that comes up almost every episode because it's just, we can't emphasize it enough. Like, there's that group out there, ewg.org, that's doing the homework, the legwork for us to help guide us on how making the best decisions for purchasing skincare products, baby products, cleaning products. And if we're all spending our money on products that are safe and non-toxic, then that's where the market goes. And instead of doing the products that are more commercialized and more mainstream, but certainly can be loaded with toxins.
And we've seen that happen. The consumers are a very powerful force, and when you've seen, like, just take the idea of BPA or bisphenol A, for example, that was
right.
Present in a lot of plastics and baby products, and it was really through the marketplace where people just said, I don't care if you're going to regulate it or not. It doesn't matter that Canada has outlawed it and the U.S. won't. We're just not going to buy it. And parents were really the ones who said, I'm not going to buy baby bottles, and I'm not going to buy spoons and dishes and stuff. And lo and behold, manufacturers said, oh, we can't sell this, so let's find other stuff, and that's a whole other, issue. But I think people can make change with how they pay for things and what they choose to use.
Mm-hmm. Yeah, it's like a global movement here of what we can do to not only clean up our bodies and our health, but also then the environment as well is impacted by that.
True. Definitely true.
Great. So I know that, as an integrative pediatrician, you have a different healthcare paradigm than most pediatricians. Can you share with our audience what that looks like? Absolutely.
Yeah, it's something, it's called Integrative Medicine, but I call it whole child medicine. It's a way to think about kids' health in a whole new way. And I really, my goal would be eventually to say, look, this is a paradigm that should really be no different than everyday pediatrics. It would be my dream to see that, pediatrics as a practice is just done this way. I'm not looking to create a new specialty. It's really just to drive the whole field towards a more integrative philosophy. So what that means is, on the surface, it can look a lot like a typical pediatric practice in that there are some principles that are just that are common threads. But what integrative medicine does is it brings together the best of conventional medicine and what we call complementary or alternative medical practices. So that could look like a number of different things. You're not abandoning everything to do with conventional medicine. You may say, you know what, there are times where we need surgery, and there are times where we do need antibiotics, but we have other natural alternatives that in many cases could be first-line options, which are equally as effective and in some cases more effective and clearly safer. Mm-hmm. So that it's really a holistic practice. You brought up the idea of mind, body, and spirit. So it's not just physical health, it's health in mind and health in body and spirit. And we are seeking optimal health, not just good enough health and not just treating symptoms as they happen, but creating optimal health. And I think that's a really important perspective. So it's very proactive. It's not reactive. We are talking about lifestyle solutions that are preventive. We focus on things like, our prescriptions are for food or for physical activity or for go play in the park, do yoga. Those are our prescriptions we try to rely upon rather than turning to our prescription pad for medications when we can. Mm-hmm. There's also a belief in individualization or personalization. So it's not a one-size-fits-all approach. Too much of medicine has become recipe-based, and a lot of, we really will take each child as they come in, even if we may have 3 kids who all have a diagnosis of asthma. That's how they come in. Mm-hmm. But each child is very different in terms of their root causes, their family situations, the context they live in, that they work in, in terms of their schools. And so they have unique genetic and environmental factors that have led them to have this diagnosis called asthma. And so we would approach those 3 kids individually and very differently and not making assumptions that the treatments are the same for all 3 kids. Mm-hmm. I think that personalized approach. And I guess the final thing I would say, there are a number of other things, but I think one of the other things that makes us unique is how we really encourage family participation in their own health care. I really try to teach kids, you are the boss of your body. You're in charge of your health. And that when we're talking about creating health, it's not a passive one-way system. It's really a two-way collaborative process. And and when you're working with whether it's adults or kids or families, when they develop that sense of control over their own health that they've lost in many cases, especially people with chronic illness, such a powerful driver towards health. And I that's the way I like to practice. I don't really want it to be some kind of patriarchal one-way system. So those are just a few of the philosophical differences I think that we have.
Mm-hmm. That's beautiful. I mean, just to think about you speaking to a child and really coming from a place of empowering them to take charge of their health. They get to control what foods they put in their body and what they're asking their parents to feed them and what thoughts they're – I mean, you can even start planting those seeds at a young age about how their thoughts can actually impact how they feel. And in a lot of ways, this is, using the placebo effect, which we know based on research works, that helps, really helps the patients heal. And it doesn't matter if, what age, I guess you can start at a really young age.
Yeah, we find that, and really this is a lesson I've learned mostly from non-MDs, that so much of other health and healing traditions have a self-care component. And so we start those messages with parents with babies, with toddlers, with really young kids, especially when they start to get to be like preschool age, to start to identify what it is when they're, what can they do for themselves? It's really lifestyle based in many cases. If you think about, we're asking kids to do some really hard things to make choices about what they eat and to get out there and play and exercise and leave the devices at home and do, especially as they get older. We're asking them to do things that may be different than many of their peers. And so the earlier you start, especially if the parents can be role models and to look at that, then kids do make smarter choices. And it's not to say that, especially as they get to those teen years, they get more impulsive. They don't make the best decisions. They experiment more. That's just normal adolescence. But when you've planted those seeds early on about healthy living and taking care of your body and your health, they tend to migrate back to that, or they find ways to integrate that in their own health. I think we undersell kids' role in their own health. Ultimately, where we see that, we see that when they become teenagers, if we don't give them the tools to manage their own health, they don't do very well.
Mm-hmm. Wow. I mean, you just made such a powerful statement there about, teaching these healthy lifestyle tools at an early age, and unfortunately, this is not what the mainstream culture in the United States is promoting, as far as, diet. We see the standard American diet is extremely sad, and this is not proponent for health. And so for your, children, especially like you mentioned, the tween teens, they want to fit in with what their peer group is doing, and so it can be hard if they're choosing to not eat the junk food or not play video games for hours. But if they've learned it from an early age, hopefully it's just a part of them, and they recognize that they feel different when they are not following that lifestyle.
Absolutely true, and they learn to tune into their own bodies and recognize when things are off. And it's one of the coolest things I've seen is some of the kids I've been taking care of for a while now are older teenagers, and they're serving as peer mentors or role models for their friends and their siblings and younger kids. And it's just amazing to see when you hear a 15-year-old talking to somebody about organic food and the importance of that. When I'm feeling stressed out, here's some breathing that I do, and that helps me feel calmer. Like that message coming from a kid to a kid is so much more powerful than if you or I sit down with them for an hour and talk about it. Yeah,
I agree. That it is. They can either. They become really leaders, like you said, to their peer group, and then this is really then transforming that community instead of having the leader saying, hey, why don't we try this drug, like these other 15-year-olds are doing. It's a whole different mindset, and it does start, from that early age. It starts before the age of 15, like you mentioned, really early, so it's just a part of their decision-making.
Yeah. I think that's one of the things that, I'm constantly, I think a lot about how I practice and the process, and I think it's one of those things that keeps me really interested in what I'm doing every day, in addition to the relationships. But I'm always thinking about, what's working, what's not working, and I feel like over time, one of the things that keeps occurring to me is this sense of power and control over our own health. And I think a lot of that, whether you're a conventional practitioner or you practice in a more natural or integrative style, there's a tendency, I even see in integrative medicine what I call sort of green substitution. So rather than prescribe medications, I prescribe herbs.
Uh-huh.
But I'm really still dealing with it the same way. It's still a symptom pops up, and this is what you take.
Right.
And I think more and more what I'm realizing is it's not just you don't have to practice acupuncture, you don't have to be a chiropractor, you don't have to use any herbs, and you can still be a very holistic, integrative practitioner if what you're about is focusing on lifestyle and prevention and those areas.
Yeah, for sure. That's really, going back to the root cause, which you mentioned earlier. And, for every diagnosis, there could be a different root cause. So it's just really going deeper than the symptoms and addressing the root cause, and then ideally, practicing prevention.
Sure.
So the root cause doesn't reoccur.
Yeah, I think that's important.
Mm-hmm. It really is. So I know that you co-wrote a book called Treatment Alternatives for Children. Please tell us a little bit more about it.
Yeah, sure. That was a couple of years ago. One of the dads in my practice, Jeff Cohen, came to me, and I'd been seeing him and his wife Carol and their kids for a while, and he's a writer, and said, we love the work that you're doing, and I really think you should write a book, with talking about the things you do every day and the kinds of remedies. There's really not anything out there that's kind of like that's current. And I said, Jeff, that sounds like a great idea. I have no time to do that. I'm busy with practice and my family and all these other things. And so he said, well, look, let's look at doing this as a partnership. And we did, and he put together a nice proposal, an idea, and the framework for a book, which was really a nice parent-doctor collaboration. And it turned out to be a much better book because of that collaboration. Jeff brought his own perspective and sense of humor and other things to the book, and I could then focus and concentrate on the actual remedy. So the way the book is laid out, it's really like a quick, easy guide to the most common ailments that we see with kids, and providing both a conventional solution to that problem and a more holistic solution side by side in different tables. So you could say a sore throat. If you have a sore throat, what do people typically do? They might use a throat spray like Chloraseptic that has a lot of artificial coloring and dyes and ingredients, or take a pain medication. Well, it turns out there are a lot of natural sore throat options, which might seem obvious, but a lot of parents aren't aware that they can do other things for their kids. And so we would look at another option that could be, I'm just going to pick something like there's a propolis or bee pollen related throat spray. It's just another way of looking at it. Or there's a tea called Throat Coat that has a number of herbs in it that are anti-inflammatory and healing. And so what we tried to do for each remedy that was natural was also provide the evidence base and talk about studies that were done either with that particular product or with those herbs or that approach. And it's not necessarily all herbal. There's homeopathics. We talk about other therapies like yoga or chiropractic or acupuncture in different ways, and just providing solutions that are alternative for parents, and they can sort of thumb through and say, oh, yeah, I need to look at this today. I need to look at that today. It was a really fun project, and I think what I hear from parents is it's just great to have that around as a resource when they're dealing with different issues with their kids. Mm-hmm. One of the challenges with that book is as you've heard, a lot of my practice philosophy is preventive.
Right.
And there isn't really a way to write that kind of book. This is really a treatment book.
Right. Symptoms.
So, it's not sort of ideal. I spend most of my day trying to prevent these things from happening, but I'm also not naive and realize kids do get sick, and they do get colds and coughs and sore throats and earaches and, joint pains and all this other stuff. So, that is a lot of what we do as pediatricians too. And we want to make the case that, as a first-line option, there are a lot of safe and effective and accessible treatments that, that hopefully are safer and avoid the side effects that the conventional treatments have.
Mm-hmm. I think that sounds like such an amazing resource for parents to have on hand in their home. The first Johnny woke up this morning with something, let's give this a go. It's not like an emergency situation. And ideally, even parents can have probably some of the homeopathics or herbs on hand, like a natural medicine cabinet to use. Really, ideally, a lot of these remedies work best at the very first sign, and so they're having awareness of what to go to a health food store and stock up on to use as that first line.
Yeah, no, I think I always talk about go to your kitchen cabinet before your medicine cabinet, that kind of thing. And these are, just to get back to the self-care thing, these are all DIY. A lot of these things you can choose. Homeopathics are fairly, it's a very complicated field in the classical sense, but I find that parents can learn pretty quickly a bunch of remedies that they can use very safely and comfortably from a young age. There are a number of herbals that we talk about. These are just things that you can have on hand, and a lot of them are based on foods or spices that you may have. We talk about aloe vera for burns, and, it's pretty easy to keep an aloe plant around. Or there are, a number of herbals like a child who has swimmer's ears. Some people use apple cider vinegar, and they're on and on. We use garlic and olive oil and all these great things. Many people just have around anyway, and learning new ways to use them, which go back hundreds and hundreds of years, but these things actually work, and there's some good science behind it. So it really, again, it just empowers families to help to take care of themselves.
Yeah, I think that's really awesome. It goes back to that putting the healthcare really on the responsibility on the family as opposed to just expecting the doctors to fix it all.
Right, exactly.
The relationship, it's a partnership.
Yeah, it absolutely is, and I really strongly believe that partnership has healing properties in and of itself. I think that's when you talk to old-time practitioners who've been doing this for a long, long time, that's really what they will talk about and value, and those are the stories you hear, and I really think that's what works best for most people.
Mm-hmm. Is there, I know you mentioned it's mostly symptom-based. Is there anything on lifestyle in the book?
Not so much. I think when I've thought about, all right, so what should the next book be? I just have to find somebody else to write it with. So when I think about that, it's, that was the challenge in writing this book, and I strongly believe that there are these lifestyle prescriptions, and you can, I've even written about it from the idea of turning this idea of prescriptions around. Prescriptions for so long have been about drugs and medicine, but what if we literally had a prescription pad where we wrote, RX yoga on it, or nature, or food. It's a powerful way about thinking about it. These lifestyle solutions, getting good exercise, getting fresh air, food, stress coping, sleep, and on and on and on. These are all the real foundations of health. They happen to be the safest, most effective, and most cost-effective strategies we have.
Right.
So I wish that we spent a lot more time creating a healthcare system that honored that and promoted that.
It's so true. This is all really kind of basic, almost common sense advice that's good for all of us, children, babies, pregnant women, non-pregnant adults. All of us can benefit and thrive with optimal health if we just follow, eating cleanly, like you said, moving the body. Sleep is really important as well for the body to heal itself. These are really basic things. And it's, what I see a lot of families in the practice, and, the whole entire family will receive chiropractic care together. They come into the office together, and the baby, toddler, mom and dad all get adjusted. And, I see that family unit really even thrive, emotionally better because they're all free of nervous interference when they leave my practice, and that is going to impact their emotional state. It's going to impact how they're able to, physically play with their children. I mean, it's just really powerful stuff when we see how this can evolve.
Yeah, I agree with you, and it's so great that you have this opportunity to work with the whole family, and that's something most pediatricians don't. Obviously, we don't directly take care of the other family members,
right?
But we do have relationships with families. I often have grandparents who bring the kids in, or people will talk about the extended members of their family. Parents will ask about their own health. People ask about their pets.
Right.
It's not that we're directly treating these people, but really we are treating kids in this context, and I think it's great. You actually literally can treat the whole family. I think it's a very powerful method.
Yeah, and then, to your point, you're educating these parents on lifestyle things that are going to impact their own health, even though they're not directly a patient of yours, by them setting an example for their child of how to eat well. Like, for example, a picky eater, I find a lot of times it's because they're seeing what the parents are eating, and they just want to mirror and, follow what the parent's example is. So if they see a parent eating spinach, they're probably more likely to eat that food themselves. Do you see that as well?
Oh, absolutely. Yeah. I mean, it starts especially with feeding, the cultural traditions, the way that parents eat. It's amazing to me how often these parents can be very healthy eaters, and no matter what their dietary preferences are, if they're eating, and all of a sudden they have a baby and they start feeding them white powdered rice cereal. And I mean, I think in our practice now we've gotten to the point where most people aren't coming in and doing that, but it's just always boggled my mind. Why would you feed anybody that?
Right.
So we talk when the babies are 4 to 6 months of age, and we're starting to talk about complementary feeding, and the mom's nursing, and she wants to know what to do. We start to talk about vegetables and fruits, and I get a sense of what do you eat, and what cultural or geographic or ethnic preferences you have, and how do you eat. And often I get these, for many of the families in our practice, because we tend to draw more holistic families, they're eating a very healthy diet for the most part. So we just try to have them extend that to their babies. And those kids grow up and they eat a really wide variety of foods that taste great, and they're full of healthful ingredients.
Right. I mean, this is really the building blocks of what this child's body is being made out of, so it's so important. And I think, to your point with that rice cereal, there's some crazy marketing that's going on that just promotes these products for babies as being safe and natural, and not all products are. You really have to read labels, and you have to understand what's in the food or product, and understand if it's something you're not going to put in your body, why would you want to put it in your child's body? And that can even apply to formula. And I've seen parents who do eat healthy have their child on formula, and when I talk about the ingredients in the formula, they look at me blankly because they've actually never read the label on the formula bottle. And it's like, oh, wow, there's corn syrup in here? They wouldn't put corn syrup in their body, so it's just that awareness.
No, absolutely right. That's really important.
Yeah. So I was hoping that you might have an interesting case from your practice that you can kind of share how you've used integrative medicine to help a child's health.
Sure, I can use it. I mean, I can think of numerous examples from this morning. The nice thing about practicing the way I do is that it becomes part of every visit. So I do, in our practice, we do checkups, and we have kids who come in for sick visits, and then I also do some specialized consultations where I'll spend an extended amount of time with a family. It might be a new family coming in because their 12-year-old has ADHD or has been diagnosed with ADHD, and it's been recommended that they start medication, and they don't want to do that, and so what else can they do? Or they have a 5-year-old who has food allergies and asthma, and they're looking for other ways to manage that. So I get to integrate that in a lot of different ways. around this time of year, well, we pretty much see everything this time of year, but something like ear infections we can talk about, because I think that's interesting both from an acute and more chronic perspective. They give you a sense of how we approach problems as well. So a lot of, one of the most common reasons for visits to pediatricians are earaches. And the standard treatment is typically a child will come in, could be a year and a half old with, low-grade fever, some irritability, nasal congestion, but they're not dehydrated, they're feeding okay, they're consolable, and you look in and you'll see that, they have an acute ear infection and they get put on antibiotics, and that's been the sort of standard conventional approach for many, many, many years. Although over the last 10 years or so, there's been an increasing awareness about the overuse of antibiotics and the lack of necessity to treat infections like ear infections or sinus infections with antibiotics most of the time. So then the question is, well, then what do you do? And my answer is, well, the first question is, look, if it's a child who's otherwise healthy and well, comes in with one ear infection, you deal with it, and we'll talk about how to deal with it, and then they go home and they never have it again. That's one story. The other is a child who comes in who's had 4 or 5 ear infections, comes in and they're transferring practices because they're not happy with getting prescribed 1 million antibiotics, and they want to know, well, what can we do? The first thing you have to think about is, why are they getting so many ear infections?
Right.
So part of the approach is that root cause. Is it because they're dairy allergic? Is it because there's something, someone's smoking at home? Is it because they have a family history of everybody has ear infections and anatomically there's something going on with their drainage? And all of those things lead you to different strategies to not just treat but prevent these ear infections from happening in the first place. Have they been on so many antibiotics now that they've got a lot of gut disruption and they've never been on probiotics, and so you have to spend time sort of, helping their gut heal, and so their immune system's stronger, and so they can fight off infections more effectively. So those are a number of things we start to look at. And then from the treatment perspective, there are many natural ways to treat. Why do parents bring in their kids? Because they're in pain. It's, whether it's viral, bacterial, fungal, no one really knows. But the truth is their child has inflammation and pain, and so there are some quick, easy, natural herbal eardrops that parents can buy or make that are made from olive oil and garlic and calendula and St. John's wort, nice mixtures that we can teach them how to use, and they can use those for symptom management while they're waiting for the child's body to heal itself and get better. We, probably one of our number one referral reasons for chiropractic is for ear infections or chronic ear infections. And there are numerous studies that show that kids that have especially chronic fluid buildup or eustachian tube dysfunction can benefit. And if it's a choice between that and going for tube surgery, I know what most parents would choose. And it works. It really works. And so, that's just, and that's another way to approach it. So that there are a number of different solutions. We wondered, do they have food allergies or other allergies, and we evaluate that. So those are some, sort of generally well kids, and that's one of the more common issues that we see and how we approach it. From a more complex perspective, we do have a number of kids who are diagnosed with attentional or focus problems in school, typically, between 3rd and 6th grade. A case from this week, a boy who was sort of doing well up until 3rd grade, and then all of a sudden, over the past year and a half, into 4th grade, he's struggling more and more, having trouble paying attention and focusing, and the teacher mentioned to the parents that there's a problem and suggested they have either the pediatrician or the neurologist or somebody evaluate and diagnose him with ADHD and put him on medication. So that's a really common story today, and we do not have nearly enough time to delve into why this is happening more and more. Is there truly an increase in ADHD? Why are kids being labeled this way? What's happening in the educational system? What's happening in our environment? And all these are really, really important conversations. But the truth is I'll have a family show up and come here and say, well, what do I do now for my kid?
Yeah.
I'm very honest with him. We'll say, look, it's not that I never prescribe medication for these things, but if you're telling me you have a 9-year-old boy and you haven't really tried anything else and we haven't looked at their their lifestyle, their diet, their sleep patterns, their exercise, their time spent on electronic devices, their family history, their family environment, their social environment, what else is going on. And let's talk about diet. Let's talk about specific nutritional things that we need to take a look at. What about other ways of managing inattention and distractibility and focus? And so it just opens up a very broad discussion. We start to establish a relationship between me and the family and the child. And it's not a 5-minute visit where they come in and they're diagnosed and they leave with a prescription. It's the evaluation process takes at least as long as the treatment process, and that could include looking at a variety of different evaluation tools and solutions that range from manual medicine to acupuncture to herbals to nutritional approaches. It's very eclectic, and it's, as I said before, it's highly individualized. And we have a pretty good success ratio at helping these kids not only be more effective in learning in school, but in life, and help the families, heal and feel more comfortable. And so those are just a couple of brief examples of the way we look at two different issues.
Right, and it's interesting because even those two diagnoses, once again, there's different potential root causes going on. So I think that's what's so important for parents to know that this is possible. Number one, it's not one root cause equals one diagnosis, which equals one prescription medication, right? Let's see what the issue is here and let's address it. And for more chronic issues like a child, for example, on the spectrum, multiple modalities might be necessary in order to really fully resolve the issue. But it's worth it for quality of life for the child, for the family, and to help minimize their chemical exposure.
Yeah, I think that's a really important point, this idea of multiple modalities. It's not something that in conventional medicine we are very comfortable with. We're sort of, you have a symptom, you treat that with one solution, and we don't do a number of things at the same time because we're not sure what's working, and we want to have it's sort of this idea that if it's a randomized, controlled trial of one thing at one time, well, the truth is, in a more holistic approach, you wouldn't just say, let's work on your diet, but don't exercise at all. Don't do that for now. That's going to confuse things. So we have to get comfortable with this idea that as long as we're not causing harm, this idea of sort of multimodal solutions, and thinking about both an individual and a family context, we need to think about all those things at the same time. So I think that is a differentiator as well.
Right. And a lot of it, once again, these multiple modalities are like more lifestyle, education, and they're also using, natural type of modalities that don't have, side effects. So we're not necessarily, or, very minimal. So we're not really concerned about like throwing a ton of stuff at a child. It's more like making shifts. And sometimes it has to be baby steps too. It's like, okay, we'll do this for 1 week and then we'll bring in something, and there's a long-term plan there so the family is not overwhelmed like, oh my gosh, I have to do so many things.
Exactly. Yeah.
It's you meet the family and the child where they're at, and then, you go from there, and that's really where that individualized medicine comes in, which I think is so important.
Yeah, it's true, and I think what's interesting to me when you look at other types of medicine, traditional Chinese medicine, for example, involves a mixture of herbs and acupuncture and dietary changes, massage, and these things are all done in concert. It's all synergistic,
right?
And those sort of pathways of healing are very different than the standard 21st century medical system we have here.
Mm-hmm. Right, and once again, it just kind of makes common sense, I think, that's how it would be, managed. So
I agree
very
with you.
Cool. Thank you for sharing that. Recently there's been a lot of hype regarding vaccines and, outbreaks and such, and that's actually driving some legislative activity towards, vaccinating larger groups of people and even possibly adults. I was curious if you could share a little bit about your thoughts regarding that.
Yeah, I know the vaccines are the most hottest of all the hot topics, and it's something I talk with parents about many, many times a day, every day. And so just to outline my philosophy, because it's complex. I don't think vaccines are a simple thing. I know I have colleagues who feel, nope, that's it. That's what it is. Everybody needs to get vaccinated with everything, and there's really no debate about it. While I am pro-vaccine and my kids are vaccinated, I believe in vaccination as a public health policy. And I personally believe that there's evidence to support that we've decreased the incidence of lots of diseases because of the idea of public health vaccination. So I'm in that camp. That being said, I also believe that it's not a one-size-fits-all approach, and I like with any medical intervention, there is a risk, and there is a risk for harm. And you may look at that and say, well, I've decided that the benefit far outweighs any potential risk of harm, and that is how the conventional pediatric system sees it. But I think it's unscientific to say that there is net harm to any child from a given vaccine, including severe adverse effects. And so while they may be quite rare and hard to pin down, it is true that there are some children who will have adverse effects to vaccines. And so in order to have those discussions with parents, I think you have to be honest with them and not come from a place of la-la land and say, no, this never happens, it never happened, you don't have to worry about it. Then they don't trust you at all, and then there's no dialogue or discussion at all. And so in our practice, we've taken the approach that when we're weighing the public health needs versus individual rights of parents to choose for their kids, we do side with the point of individual belief. And, it is my belief that a parent has the right to decide for their child whether or not they give specific vaccines. And I know that's controversial, and I accept that. By the way, I don't feel that way about all healthcare interventions. And I think there are times where there is such a dramatic benefit-risk ratio that it crosses the line of personal choice. But I don't think that applies to vaccines. And so the approach we take is to start with parents when they come in and have an open and honest discussion, feel them out about where they stand and what their beliefs are, and continue that conversation. And while we do, and we don't bully anyone, we don't kick people out of the practice, and we hope that by having a mutually respectful conversation, parents will make the best decisions for their kids. Yeah,
I think that's just so wonderful. Like, that's how your practice is run. And, for the first-time mama-to-bees out there who are potentially now interviewing for pediatricians, it's important to know that not all pediatric practices operate from that philosophy, and sometimes if your personal philosophy as a parent is to perhaps not use all the vaccines for your child, you want to have that discussion with the pediatrician ahead of time, because there's a chance that they may not accept you as a patient.
Yeah, and I think, one of the pieces of advice I'd give to prospective parents, new moms, I'd say, look, whatever your beliefs are in vaccines or ear infections or whatever, you have to feel comfortable having conversations with your pediatrician,
right,
or any healthcare practitioner. And if you don't feel that there's leeway to have a discussion, then you're in the wrong place, and that's just my belief.
Yeah, and there's that gut, feeling like when you're talking to a birth, I was going to say birth provider, because this applies when you're pregnant, interviewing to find the practitioner with the right philosophy, but certainly the same thing goes for interviewing for pediatricians, and just really asking those questions and having that conversation and feeling respected on what your philosophy is, and not feeling bullied or put down because you have a certain philosophy on health.
Right, exactly.
Yeah.
You want to build that partnership. That's true.
Yeah, it really is. And it's so, exciting to know that there are, practitioners like yourself that do exist, that you can have these open dialogues with and feel that your opinions are respected.
No, yeah, thank you, and I think that the more that we can promote open, respectful conversation and dialogue, I just think, honestly, it may sound corny, but I think it makes the world a better place.
It does. It totally does make the world a better place. I completely agree.
Yeah.
So any last thoughts you'd like to share with our audience?
No, I think I said it, and I really appreciate the opportunity to talk and have this conversation with you. I think it's great that you're doing this, and I hope that we've encouraged people to take ownership over their own health.
Mm-hmm. Yeah, that's kind of the bottom line here is healthcare is in your hands.
Well, that's true.
Thank you.
Okay, thanks.